Okay, so talking about kids and anterior cruciate ligament injuries, very much changed over the last 20 to 30 years, partly because the kids are going much more into kind of structured programs of sport, which they didn't in the past, and also the potential to offer surgery to kids that wasn't there maybe 20 or 30 years ago. In the past, if a kid had ruptured his ACL, you might have said, okay, wait until you're kind of a mini adult, and then you would have just treated them accordingly. Now we can offer surgery to even quite young kids. Again, it remains quite controversial and not every kid needs it, but if they have ruptured their ACL, there will be certain technical considerations if they're very, very young because of the growth plates which occur in the bones themselves. These are here and here. Now, you do not want to disrupt those. You don't want to put a drill through those. Otherwise, the parts of that growth plate will be stunted and they will not grow in the right way. So you really want to protect them. So if they're very, very young, you will try and avoid that. So you may go and put your graft in a lot flatter than a normal ACL you would in an adult. That's somewhere between the ages of 10 to 12, you would be having those considerations. As the kid gets older and the growth plates begin to fuse as they're getting a lot taller and bigger and stronger, they may only be partially fused at that point. Then there's a consideration maybe to put the tunnels in a slightly more vertical position. Why? Because they will then get a circular tunnel through the growth plate and not an oval, so they won't be disrupting so much of the growth plate. So again, this is a technical consideration that's based on an individual that you see in front of you. Now, if you've got a kid who's really almost finished his growing and the growth plate is almost nearly fused, it really makes probably very little difference, and you can actually go through the growth plate like you would an adult. So again, you tailor the treatment according to the individual patient.